Family and Youth Services Bureau. Prep teens for the future. Teen Options to Prevent Pregnancy, or TOPP. OhioHealth, Columbus, Ohio. Orel Jackson, OhioHealth Director, speaking.
OhioHealth is a faith-based healthcare organization, and we have 11 member hospitals in the state of Ohio. Our mission is to improve the health of those we serve, and our department, Community Health and Wellness, is really that outside-facing part of our mission of serving the community. The TOPP program is a Teen Options to Prevent Pregnancy, so it's a research project that we've been working on for the last 5 years.
NGOZI OSUAGWU, top obstetrician and gynecologist, speaking.
We focus on inter-pregnancy interval, trying to reduce the subsequent pregnancy within 18 months. We know that at this point, 30% of teenagers, when they become pregnant, will have a subsequent pregnancy within 18 months. It increases the risk of prematurity, it increases the risk of stillbirth, it increases the risk that these teenagers will not complete their education. And also the children of these teenagers are not ready for school. The other thing that makes our program unique is that we're actually bringing the contraceptives to the house. We're giving depot at home.
ROBYN LUTZ, top project director, speaking.
Using motivational interviewing, transportation, home visits, and personalizing the care to the patient. It's truly a patient-centered program. What we've done with the project, we realized that many of the nurses in the hospital weren't aware of some of the new LARC methods.
LARC, long-acting reversible contraception.
And so we've also been able to educate nurses throughout the 5 hospitals and the 9 clinics as well. So to teach them about the LARCs, to get them updated, will help for the future. And so what's exciting is to think about the changes that could happen if young women don't have that second or third baby, that they can go on with their lives and have productive lives.
Angie Taylor, top nurse educator, speaking.
The motivational interviewing is a nice, non-confrontational type of communication that helps the young woman come up with her own plan for change. The transportation aspect of the program, I really value that time with them. It's also a nice time to be able to provide education if that's something that they want, and helping to come up with a plan. So there's a lot of things to be able to do with the transportation piece. And then of course the home visits, just being able to see where they are, where they're coming from, how they live day to day.
Leslie PEREZ, top participant, speaking.
I tell her a lot of stuff, and I really like it because stuff like that you can't really share with anybody. But I feel like she knows what to tell me. She gives me really good advice.
NGOZI OSUAGWU, top obstetrician and gynecologist, speaking.
Even though they come here with a mindset of wanting a particular long-acting reversible contraceptive, we still go through all the contraceptives that are available. We talk about the risk and benefits, and then we allow them to make their decision. I think the mistake that a lot of us have made in the past is that teenagers really can't make decisions, and they really do want to make that decision. They have goals. And once we explain how to accomplish their goals and what we can do, it makes life a lot easier.
Catherine Livesay, top nurse educator, speaking.
With motivational interviewing, examining what their goals are, and then saying, okay, so what do you think about birth spacing and how that aligns with your goal? Tell me more about that.
ROBYN LUTZ, top project director, speaking.
Point out the discrepancy of, you're sexually active with your boyfriend, but you're not using birth control. Tell me about that. Tell me what you think about that. And then we can help them.
NGOZI OSUAGWU, top obstetrician and gynecologist, speaking.
I love the fact that it's broader than just talking about contraceptive, that we can actually deal with the whole teenager.
Leslie PEREZ, top participant, speaking.
To be honest, I would have probably had my second child already. So they've been a lot of help.
Family and Youth Services Bureau. Prep teens for the future. teenpregnancy.acf.hhs.gov.